Okay. Scratch the emeritus. I try to keep that off my CV at all chances. My wife says there's nothing emeritus about you at all. You're gone just as much as you always were. So I want to acknowledge we've had an advanced center that focused primarily on implementation methodology. In a circuitous way, it came about because we got a 40% cut from NIMH. It was the best cut I've ever gotten. First of all, cuts allow you then to really focus on what you want to do. I was able to take things out. And David Chambers said, look, you got your best core and research methods, go with that. And so it's turned into a actually terrific experience. The Center for Drug Abuse Prevention and Child Welfare, led by John Reed, the late John Reed, and Patty Chamberlain, was a second node of a virtual center. And then I have to acknowledge all of the work I've been doing with Enola Proctor in the Implementation Research Institute, which we'll talk about this afternoon. It's a virtual center with 2 nodes and several related implementation studies. So I'm going to approach this not from a theoretical or a framework, but from a real study of implementation research and how it illustrates historically mistakes that were made and some enormous opportunities that came about. The primary focus was on development of innovative methods for implementation research. We had design and analysis work group, which we did in combination with Robert Gibbons from the University of Chicago and with Hendrix Brown, who is now at Northwestern, 2 of the best statisticians and design people I know. A measurement work group that spent 5 years struggling with the issue of fidelity and came up with, we don't know very much on how to do it, certainly not efficiently, and certainly not the way it's done in efficacy trials. A mixed methods work group, which I will talk about, and led primarily by Larry Palinkas, an extraordinary mixed method researcher, and then an economic analysis work group, which is about the development of use of an English system of economic analysis unit costing within the child welfare system. The presentation, I'm going to talk about mixed methods. I'm going to talk about a specific study that was done, a very large-scale NIMH-funded study that used some innovative methods to it. Certainly, mixed methods was brought in. I'm going to talk about how it drove the development of a new measure specifically for implementation research that truly fits the notion of an IR kind of measure, and it also will illustrate that implementation research is clearly an emerging science with enormous work to be done. And remember, science is always what is the knowledge that you have, but probably even more important is what's the methodology that you derive that from. And this is a great example of, I think, the need for methods development in this field. It's a psychosocial intervention that was at the heart of this. All kinds of kids cannot be maintained in the home, particularly with externalizing problems. They're at high risk for going to jail, going to psych hospitals, going to congregate care group homes, for which there's no evidence base whatsoever, and actually some contrary evidence. So it was developed at the Oregon Social Learning Center, which was the second node of our advanced center. It has many randomized trials, very good evidence base, but this was a true implementation trial of 2 different ways, testing 2 different ways, strategies of trying to implement it in 40 counties in California and another 12 or 13 counties in Ohio. So 40 counties in LA and 12 counties in Ohio. LA was, and the interesting thing about this is it took out all of the counties that were early adopters. We know lots about early adopters. In a sense, that's where most of the naturalistic studies are of implementation. What we don't know is about those that don't early adopt. And so this was an attempt to go to those. And it was randomization to 2 implementation conditions, but also randomized to start time in terms of cohorts that began. Total of 53 sites. Complex design included those that had no experience with this evidence-based practice. A very complex intervention, by the way, lots of parts moving in it. And they also needed to have at least 6 kids in the last year that had been placed in congregate care facilities that was either under probation or child welfare or children's mental health. Excluded those who had already had some experience with MTFC, and those that placed fewer than 6, those were primarily rural. And then they were matched. And within those matching groups, they were clustered by time and by condition. So it's a fairly sophisticated design. It was designed by Hendricks Brown, statistician that was working with the design right from the start. Now, what came out of that? And this is really this is a story of I'm forgetting the word that I want to put in there. So it is really about the design of a measure that was intended to move from was something implemented or not, to the question about how fast was it implemented, how thoroughly was it implemented, and does that predict whether in the end you actually came to placement of a child in this multidimensional treatment home that was different from congregate care. It was developed by Patty Chamberlain. The design work was done by Hendricks Brown. And it was developed iteratively, and let me go to this one. So essentially it was saying, you know, the way MTFC is implemented could be broken down into 8 stages. First of all, there was the engagement stage with systems that might want to bring this in. There was a consideration of feasibility. There was readiness planning. All of those, and this brings to mind Steve Shortell, multiple levels within implementation research. So there it was system leaders, and agency, et cetera. Staff hired and training is when real money is put into the implementation process, and they're the agency and practitioner, staff hired and trained, adherence monitoring, all the way down to 6, which is services and consultation begin. In other words, is the implementation receiving a client that then receives the intervention? Ongoing to then competency at the end. So it came out in an iterative way out of their experience with implementing MTFC in foreign countries. England has adopted it within their child welfare system, in the Scandinavian countries, and in the United States. So the first 3 stages, and this is reporting on a study that's been published by Lisa Saldana, Patty Chamberlain, Hendricks Brown. Look, within each of these stages, there were activities that were identified by the implementers that they thought needed to be done. For example, and all of these activities were datable. In the records, there was a date that said this had happened. And so they were publicly observable in that sense from records, and there was a date so that you could think about the timing. So for example, consideration of feasibility. When was the first contact with the system for pre-implementation planning? When was the time that the first in-person meeting was held? Feasibility questionnaire completed, the initial feasibility assessment was done and sent back. All of these are very concrete, datable interventions. First 3 stages out of the 8. Primary question then in this published piece of work is, does behavior in the first 3 stages successfully predict program startup? Clearly it wasn't thought of behavior in quite the detail and a systematic way that Susan's talking about, but, and 2 things. One was looking at it in terms of variables. How much time was taken in completing these activities? How much time elapsed? And what was the proportion of activities that were fully completed? Because not all systems complete all the activities that has been mandated to or that has been suggested that they needed to do. And then the question is, does the stages of implementation completion, especially for those first 3 stages, does that have predictive validity for predicting whether kids are actually placed and the date at which they were placed in homes that had been trained in this intervention? So the proportion of the program success 5 sites were clustered differently with the different methods, low proportion but fast. So cluster 1 was a high proportion where they were relatively fast, 23 sites out of the 53, Ohio, and Ohio is a peculiar story, we won't go there. But what was the mean proportion of activities completed? 80%. What was the mean duration? It took 117 days to do that. The second cluster was a low proportion, only 44% of the activities were completed. And and that was 22 sites, and 18 didn't even complete the stage 3. So in a sense, you couldn't give a time to it. And the third were 8 sites were totally non-completers, few activities and non-completions of stages even 2 and 3. So those were the 3 clusters. This then said, now there's some discussion here, prediction of program startup, limited to stage 6 outcome, which is the use of a single bed for a child, a slot for a service that was being provided. It's talking about the system level leader behavior with regard to engagement, consideration of feasibility and readiness planning. Sites that did participate in these stages but did so slowly or incompletely were less likely to have spent time and resources well. In other words, it was wasted effort because it didn't result in that sense in a slot, service slot being filled, and the balance of being thorough but relatively rapid was key. The outcome was the combined method offered the best prediction. In other words, doing something thoroughly, those clusters of sites were more likely to fill that service slot, and that sites that took longer to complete each stage and completed fewer activities provides fewer activities had significantly lower hazard of having their first placement within the study period. In fact, cluster 3 were really failures in the sense of the investment going into providing that service. So that goes through a measure that was developed for an NIMH-funded study that did not exist, either in the implementer's repertoire or before this study got off the ground. And it was really a requirement in some sense to try to think about how do you get away from a 0-1 it was implemented or not, and put some variation in there in terms of how long did it take to do it, and also what was the completeness of doing the activities, the change, if you will, the change activities that would be necessary to bring that service to a very high-risk child and keep them out of jail or a psych hospital or a group home setting. Now I'm going to shift to one other example that comes out of this study. And the lesson that I think comes out of this is the enormous usefulness of mixed methods as an approach to doing implementation research. I remember as a review committee member in the Mental Health Services Review Committee when anthropologists first were being recruited onto that service committee. And before that, when I was starting the game, there weren't any anthropologists around. And they really have brought in a very different, but the first anthropologists only did qualitative work. They were ethnographers. The mixed method is the notion of bringing together both qualitative and quantitative. In this California study, the mixed method portion of it, because of budget shortfall, was taken out from the beginning. So there was no mixed method to begin with. W.T. Grant stepped in and provided money for Larry Palinkas to bring in mixed methods into this particular study. And he really used it as a way of moving into thinking about the use of mixed methods in implementation research. what is it? It's a method, and here I'm taking some slides from a 2010 presentation that Larry did for the Implementation Research Institute. It's a methodology that focuses on collecting, analyzing, and mixing both quantitative and qualitative data in a single study or a series of studies. Its central premise is that the use of quantitative and qualitative approaches in combination provides a better understanding of research problems than either approach alone. I believe that in the area of implementation research, one could amplify that by 2 or 3 times. Let me go back there. What you do, mixed method designs, and it's really a way to collect data both quantitatively and qualitative, but it's also a design issue. So you combine qualitative approaches into a research method. It's not merely parallel play, it's a model for and of interdisciplinary work. And it can be used simultaneously to answer confirmatory and exploratory questions and therefore verify and generate theory in the same study, which Larry had taken from 2 researchers in this area. Finally, the last kind of little mini session in here, it allows for simultaneous designs where qualitative and quantitative is carried out at the same time, and sequential designs where in a planful way one can move from one to the other. Now, the stages of implementation completion measure is a nice example of the development qualitatively of those 8 stages. In the MTFC world of the Oregon Social Learning Center, they'd never thought of it as an 8-stage process. And in preparing the NIH application, they started thinking about are they going to measure it so it's not a 0-1 implement or not implement, but rather brings variation in there. And so it's a very nice example of talking to the MTFC implementers that were rolling it out in England, in the United States, actually that were not part of research studies. How do you do it? And they came up with these 8 stages. Quantitative was turning that into core measures, duration, which is 8 stages, how long to complete, and then proportion of activities within those stages. It's really a time to event. It's taking the time to event kind of analytic framework and dating the stage completion and dating the activities. By the way, they looked retrospectively into their own agency, their own records at MTFC, and they found that the stage data was there and the activity data was there, and there were dates. There were an obsessive crew, I tell you, that were going through that. So essentially they were able to map it onto it retrospectively and then prospectively with this study. Now, Larry Palinkas, now I'm going to shift back to a true mixed methods study. So Larry said, got the money, I think it was $25,000 from WT Grant to begin with, because he could get it fast. And he did interviews with people in the agencies, mental health, probation, and child welfare, because they were to collaboratively work together. And he found 38 directors, assistant directors, and program managers of these 3 systems, and he got in his car and he went to 12 counties and he interviewed them in terms of how did they go about thinking and playing with the notion of bringing a new evidence-based intervention in. So that was clearly trying to develop a framework for it. Then he went quantitative and used a web-based survey in which he asked them which of the strategies they used that they had talked about in the more qualitative, and also did a social network analysis. Who did they talk to? Who did they talk to within the county? Did they talk to anybody outside of the county? And that then generated a sociometric data set created to examine advice seeking and network structure. It's really the use of a system science approach, which is social network analysis. His findings were that networks expose leaders to information about evidence-based practices and opportunities to adopt evidence-based practices. So it really underscored the notion that networks might have something to do with how this takes place. Successful implementation of EBPs requires consideration and utilization of existing social networks. What he found was that successful sites were networked both within and outside of counties. 80% had contacts that they would consult with or talk about informally outside of the county that they were working in. Clearly underscored the notion that implementation is a collaborative enterprise. Now, an interesting outgrowth of this, of course, is when you use a randomized design, you make the assumption that you have independence of units. And what this study did was actually call into question the degree to which independence between counties and the adoption of evidence-based practices and the implementation was really only within that county, because he found numerous examples of where there was collaboration going, advice given, advice received from others that they knew outside of that county. So in that sense, it is a study that says the social network analysis should have been done before the study was designed and carried out in order to understand what those social network, what was going on with those social networks. Time, we are right there, Ralph, right on time. So one last sentence. So this is a lovely example of an NIH-funded implementation trial using some complex randomization in there, but also that generated a new measure that is now being tested is, okay, if it can predict, has predictive validity in terms of MTFC, Lisa Saldana has now got an R01 looking at, could it be used for other psychosocial interventions in the area related to children's mental health? And that's what she saw. Are there common elements across, and then are there elements that are unique to that particular one? Thanks, Rob.
Thank you.